back to Sunday Live here at Citizen Television. You can see we have two sets of guests, and we're keeping our social distance from each of them. On this side of the room, Gladys Mugambi. She's head of health promotion at the Ministry of Health. She'll be joining us in a little short while. In the meantime, Victoria.
That's right. With me is Dr. Njenga Kariuki. He is an infectious disease expert as well as a professor of emerging infectious diseases at Washington State University. Thank you so much for coming in. As we try to get a better understanding on this virus, still very new. We heard the Health CS earlier this evening talk about the next 2 weeks for Kenya will be very critical. Why do you think he said that, and what do we need to be doing within that span of time?
Thank you so much for having me, and I really appreciate the chance to be here. First of all, I think it's important to start by saying that the government is doing a very good job, particularly CS Mutahi Kagwe is doing a really good job of guiding the country. The reason why the next 2 weeks are critical, if you look at every country that has had COVID-19, after the travel-associated cases, that is cases, as the CS say today, that are associated with traveling into the country, there comes a period which we call a period that establishes community spread. That means the virus is now moved over to our people, and it's now spreading amongst us. And that's why these next 2 weeks are important, because so far, most of the cases that were reported, the first 7 cases, were all travel-associated. And as soon as we begin to confirm that the virus is being spread amongst our people, then it becomes a very, very dangerous time, because that's when, in all the countries, that's when the number of cases have increased. Right. That's when the extent of severity has increased, and that's why the CS is extremely concerned about the next few weeks, just because we have confirmed cases. Now, one silver lining in his conference today was that for the new 8 cases, he seemed to suggest that all the cases, including the 5 Kenyans, were still travel-associated, which was very encouraging. We are still waiting to see whether there is any evidence of community spread, and it does seem like, from his presentation today, that is still not fully adequately confirmed, which is good news for Kenya so far.
So when you talk about community spread, that's where the danger zone enters, and we see that line or that curve go up in terms of numbers and cases. And we keep hearing this phrase, flatten the curve. What does that mean, essentially?
I would like to, I know you have a figure for this.
Yeah,
I would like
get
to
that going.
I would like to be able to, the meaning of flattening the curve is really to bring down the number of cases that are being reported on a daily basis to a level that is manageable for our healthcare systems. That is the main meaning. We have accepted that this virus is going to be walking across the communities. It is the most highly transmissible coronavirus we have seen in 30 years. However, as it spreads, it tends, as you have seen in Italy, as you have seen in other countries, to completely overwhelm the healthcare systems, and that leads to increased deaths. Flattening the curve, as you can see the figure there on the screen, shows that if you look at that figure on the screen, the large, bold gray figure shows how the spread is happening rapidly, very, very quickly, and really overwhelming the health system. What we want is the lower figure that you're seeing down there that shows a gradual increase that allows the healthcare system to be able to see cases that they can manage gradually, so that our systems, the respirators, the doctors, and the inpatient rooms are not overwhelmed by the system. And for us to do that, it takes more than the government. In fact, the government has a very little role to play in this. All of us as citizens must come in to be able to flatten the curve. It cannot be flattened by what the government is doing, closing the borders and everything. It will be flattened by all of us Kenyans doing our role in making sure that we do social distancing and prevent spread.
Let's talk about another approach which in other countries was seen as very key in dealing or getting ahead of the pandemic, which is testing. We know that the government has done a lot of screening, which is not testing, but when you look at the 2 different approaches, which is most effective, and why is testing so important?
Testing is very important because we, as we mentioned earlier, we want to really follow, particularly in the early stage of the infection, we want to follow how it's spreading in the country to be able to know, number one, whether, as I mentioned earlier, we have community spread, but also the areas that are hardest hit so that we can invest resources there. It does get to a level, and I think in terms of your question about screening and testing, it does get to a level, if you look at countries like Italy, where the numbers become exponential, pretty large, and testing becomes pretty difficult, and screening becomes becomes the main method of being able to detect those cases just because of the overwhelming nature of the system. Right now, for us in Kenya, it's extremely critical that we continue to test and identify every case because it helps the government, it helps the experts track how the disease is spreading and then position the resources in the right places so that we can be able to confront it.
And speaking about tracking, because when you look at the progression of the disease in Asia and Europe, it appears that the disease profile, if you will, is a bit different in Africa. Is that the case from your observations?
So far, that seems to be the evidence. If you look at 41 countries in Africa have had cases, the highest being in Nigeria. Nigeria, which is the most populous country with almost 2 million people, has had less than 10 cases, which is amazing because they reported the first case over 2 weeks ago. It is surprising for the experts why the disease is a lot slower in Africa than it is in Europe and North America. One of the hypotheses that some of us think might be the reason is the weather.
Okay.
We have a lot warmer weather than we have in Europe and the US, and that cold weather generally leads us to be more prone to pneumonia and disease like those. That is the good news, that we have warmer weather, and perhaps that might be what is slowing the disease. But I think the warning for us is that we are heading towards the rainy season. We are heading towards May and June, which is the colder season. So what happens when those colder fronts come into Africa, and then we are faced with almost the same environment that allows spread? So that's a hypothesis. Right now it's not proven. But it's surprising how even in countries that you think, for example, populous countries in Africa, where you think it would spread, it's a lot slower, and it may very well be to do with the weather, but it's not proven.
Okay.
Dr. Kariuki, if I can step in there for a moment. WHO boss Tedros Ghebreyesus the other day warned African countries that maybe you're not reporting the right numbers. Is there a fear that there's under-reporting of the numbers on the continent?
It is possible, but I don't think it's significant, and I'll tell you why. I think it's possible we are missing cases. This is, as I said earlier, the most highly transmissible coronavirus we have had. So it's possible that there are cases. But because of the explosive nature of the spread, even if you assume for a moment, Jeff, that we are missing a few cases, we would soon hear of a cluster in Nyanza, for instance. We wouldn't even need to test. We would hear there are 10, 15 people. It's so fast, so explosive in spread. So I don't think that's significant. I think so far, I think the evidence suggests that it's not spreading as fast, even if the testing's a little bit behind and it's possibly missed, but I don't think it's that explosive. Yeah.
All right. Very interesting, just watching this progression as we move forward.
Absolutely. We're going to go to our next interview in a little moment, but first listen to this story. Beaches and other recreational facilities in Mombasa remain deserted following the closure directive by the County Emergency Response Committee on COVID-19. Some of the areas hardest hit: Mama Ngina Waterfront and Jomo Kenyatta Public Beach. Our very own Francis Mtalaki reports from Mombasa.
On a Sunday like today, Jomo Kenyatta Public Beach, commonly referred to as Pirates Beach, would ordinarily filled by revelers. But it is now deserted. One can hardly come across businessmen on this beach. Along the coastal line, there is no one enjoying the Sunday beaches. What is left is the waves and tides, washed over by patrolling security officers.
Mimi kama mimi sijakula rafiki yangu. Hakuna pesa. Ukiangalia hali ni sitategemea watu waje ndio tufanye kazi.
Na tunaumia, tuna watoto wadogo. Kutoka juzi tunabumburusha na watoto, nakimbia na mtoto mdogo kama huko. Matiaga si inarushwa, mtoto anaingia matiaga. Hiyo ni haki hata kwa serikali. Na tena wanatarajia sisi tena tuwapatie viti kama hivyo.
The government, through the county response team co-chaired by Mombasa Governor Ali Hassan Joho and Mombasa County Commissioner Gilbert Kitio, has insisted that the directive will remain in place at least for the next 30 days. The government is calling on citizens to be on the front line in ensuring they remain safe from the virus.
Sisi hatukatai, watufungie, watuletee chochote hata kwa nyumba, watuletee rent, watuletee pesa ya matumizi kwa nyumba madogo madogo.
Na ningependelea serikali ifungie wageni wote, wakubali sisi locals tuendelee biashara zetu, kwa sababu akisema wanatufungia sisi, hii corona inakuja na watu wanapita na ndege juu, wafunge ndege huko, watu wache sisi huku, sababu sisi wa chini ndo tunaumia.
Francis Mtalaki, Citizen TV, Mombasa.
All right, joining me live on this side of the room, Gladys Mugambi, Head of Health Promotion at the Ministry of Health. Gladys, good to see you.
Thank you.
Social distancing.
Yes.
But Kenyans, our people, what is wrong with our people? People were clubbing as of last night, late into the morning, here in Nairobi. What's wrong with our people?
Very difficult. As you've seen, they're asking us to keep the planes up there and provide to them rent and all that. That must change. This is not business as usual. The stories of Serikali Saidia out.
Yeah.
Because this is not a problem that has been brought by Serikali. This is a problem that is a global problem. So people must change their behavior. Stay indoors.
But they're not believing you, Gladys. No one is believing you. Churches this morning were packed. What's going on? They don't. What is it about us? Or you're not maybe sending the message properly?
We need to send the message together. So we are trying our best to ensure that people understand what this is. And that is what Dr. has just told us. This is a disease that is spreading very fast, and it's global. So maybe we need to use tougher words like our CSD today. Let us stay away from each other. Let us keep indoors. Only essential services can continue the normal way.
At the same time, look, is it going to come to a complete lockdown for our people to understand? And if you do a lockdown, what happens to social distancing in places like Mukurukwa Ruben, Mukurukwa Jenga, in the slums? How do you social distance in slums?
We need to be innovative. Many things can be done. One, there could be people in the slums who have another place where they can move to. And they better move because it's their health. And if there is anything the government can do, then we can do. Locking people in their small houses. Because there's no other way. We cannot say that we leave that group because there's nothing we can do. We have to do something. And it starts from the Kenyans themselves as individuals.
You know, maybe we need to go the Uganda way. Send in the police, send in the military. You know, be drastic.
True.
Is it going to come to that?
It might. If we don't change, it might come to that. Because if it continues spreading, then that curve we want will not go flat. So we have to change.
Yeah. Tiki.
You know, Gladys, I'm curious because I know there's concerns about individuals who live in maybe informal settlements been told not to go to the rural areas for obvious reasons. But when you look at the profile of many of these people, they are low-income earners. Many of them are casual laborers. If they lose their source of income in the city, they have no choice but to go to the rural areas. So how do you kind of fix that situation when you're telling someone to stay where they are, but they can't sustain themselves without any income?
I think in terms of income, first of all of us have to change. Let's first of all take care of each other. If there are people amongst us, if we talk of churches, if there are people in the church who are not able to take care of themselves, I wish others could help them. Because we may have to engage other means to ensure that people have money. The government can come in, but we might not satisfy everyone. So it's about food every day. And you've talked about people moving from the slums to the rural areas. If they move early and they go and stay indoors and they're able to eat what they have available, that will be okay. But again, we are discouraging people who might have been in contact with these cases, going to the rural areas where they'll find their parents who are older and then infecting them. So there's a lot to be done, but wherever you are, even if it's a small room, it's good to stay indoors. Yeah.
Gladys, you sound very scared.
I'm very serious.
Now, there's a question here for Dr. Njenga before we wrap up. In terms of how this ends, because we've seen a great sense of hope in terms of recoveries. And the question has been, will we build enough of an immunity against COVID-19 if you do recover? And what's the end game? Should we see this pass globally?
So that's a good question. So is there immunity? I think let me start with the first question. From the experience that we have, if you look at all the other diseases, particularly the coronavirus infections we've had, if you do get infected, there is immunity. For this particular disease, we have only had 3 months of data because the first case was in December. Right. But we are following them. But if you look at the past data, it would suggest, or the past diseases, it would suggest that we are likely to have immunity. If you are infected, you likely have immunity and protected for a season, which means for a year. Right. So that's what we are working on. If people do get infected or we have a vaccine, you do it for a year, it's very unlikely that they can get reinfected again. In terms of the end game, there are two possible outcomes when you have an outbreak like this. And I must state that in my lifetime, this is the true pandemic we've had. All the other flu pandemics affected small parts of the world, like Western Africa, South Africa. There is no pandemic I know that has swept across the globe, and every country is fending for itself. So this is very uncharted territories for the whole world, and I think that's so clear for us. So what's the end game? There are two possibilities. One of them is that this epidemic will burn out and disappear. That's what happened with the SARS outbreak in 2002. Disappeared, we have not had any cases unless there is an accident in the lab. But the other case, the recent coronavirus, which actually we are investigating in northern Kenya, which began in 2012, called MERS coronavirus, it went up, went down, but has continued steadily, which is what we call a chronic phase, where we learn to live with it, like common cold, that it becomes part of us, it becomes part of diagnosis when you go to the hospital. That is the most likely scenario in this particular case. I think it's going to go to a level where it becomes common. There is a level of what we call community immunity. Okay. Over 60% of us have been exposed. We have immunity, so it does not cause widespread problems, but it becomes also milder. As you get exposed 1 year to the other, oftentimes the disease is not as severe as the first time you get it. Right now, the problem is that all of us are new. Nobody has ever seen this, so we have no immunity. So it's likely to become chronic and become a bit more milder, and then we don't have to worry about it anymore because it's part of the routine flu that you go to the hospital. And if we have a vaccine, then you get vaccinated. So that's a likely scenario. But I want to say the last thing before Victoria, that I think just to echo the CS, I was part of the Rift Valley fever outbreak in 2006, 2007. I would like to appeal, join the CS and the government to appeal to the church leaders. They have a platform that no one else has, and they are really powerful in talking to their people. They can really help us flatten this curve by, number one, doing a better job of making sure they don't congregate, but number two, talking to their followers. Yeah. They tend to believe them well, and we really need them to help the government and all of us Kenyans to not go the Italy way, to not go the Spanish way, and be able to flatten this curve and save our people.
Invaluable wisdom. Thank you so much, Dr.
Absolutely.
Kariuki.
Flattening the curve.
Absolutely.
Dr. Njenga Kariuki, WSC, thank you so much. Gladys Mugambi from the Ministry of Health, thank you as well. Thank you. Time to take a quick break.
Indeed.
Come back. We still have plenty more ahead. There is sports to go, right? Stay with us. Sunday Live takes a break. We'll be back in a moment.